Anorexia and depression. Anorexia and depression very often occur together. These two conditions are so intertwined that experts are still discovering what characteristics they both have in common. Aside from the fact that anorexia and depression can both be life-threatening, people who have either condition were found to have abnormalities in their brain chemistry. Evidences from some studies point to the possibility that genetic factors may have some bearing on the incidence and development of these illnesses. Here are some findings about the co-occurrence of anorexia and depression. The American Journal of Psychiatry reveals that approximately 50% of women who have anorexia nervosa also have depression. In addition, the incidence of depression is also greater among family members and close relatives of women who are suffering from anorexia. This supports the supposition that depression and anorexia can have genetic roots. This claim is further strengthened by the findings of National Alliance for Mental Illness, which proved that the two conditions share similar neurological factors. These findings indicate that people who have depression and anorexia were also found to have high levels of cortisol, which is a stress hormone, low levels of serotonin, which is a hormone that acts as mood regulator. Anorexics and clinically depressed individuals also have low levels of hormone epinephrine that plays a role in regulating one's mood and emotions. Helpful tips for treating people with anorexia and depression. People who are suffering from co-occurring disorders, such as depression and anorexia nervosa, should undergo a holistic and integrated treatment plan to lessen the risks of relapse. The following are some helpful tips to keep in mind when treating people with these co-occurring disorders. Stabilizing the person's physical health by correcting their nutritional deficiencies must be among the first priorities. Their emotional side must also be addressed with utmost importance. Dietary counseling and nutritional therapy must be done not only to the person affected with the illness, but it should include sessions where groups or family members are also present. Parents, siblings and other household members must also undergo family counseling. When looking for a rehab center, seek facilities that offer treatment programs for patients with co-occurring anorexia and depression. Make inquiries to ensure that the staff of therapists are also highly trained to handle patients with co-occurring mental illnesses. Avoid comparing yourself to others. Remember that there are people who respond well to medications while others find themselves recovering through nutritional counseling alone. However, there are also anorexics who strongly need intensive counseling to be able to combat their negative thoughts about food. Most of all, there is no clear-cut, surefire way to treat anorexia nervosa. There will certainly be cases when anorexics will have to undertake different types of treatment methods before they will be able to find one in which their minds and bodies will respond positively to. The success or otherwise of any particular treatment process will depend on many factors. These will include the different steps and methodologies for managing co-occurring disorders, the support that anorexics are getting from their families and loved ones, and the patient's determination to get well. If you liked the video, give it a thumbs up, leave a comment and share it with your friends. Thank you very much for watching. For more nutrition, health and beauty tips, please subscribe to our channel.